It's vitamin time. Woo! Okay, so there's not that many vitamins that we're going to talk about, but there are a few. So first, there's fat soluble and water soluble, and then these three puppies right here. Fat soluble are A, D, E, and K. A, Dick, fat soluble. Water soluble are a whole bunch of B's and C. Okay, so the main difference, I know this is like going back and forth. The main difference between fat soluble and water soluble. Fat soluble are stored in your body. You do not have to take these vitamins every single day because they are stored in your body. So like I got vitamin D stored up in my body somewhere. I got vitamin E stored up in my body somewhere. They're stored in your liver, in your fatty tissues. So that's the somewhere where they're stored, and they are not required for daily intake. So let's talk about vitamin A first. Vitamin A you get from liver, you get from fish, dairy products, egg yolks, dark green leafy vegetables, which you can get like everything from dark green leafy vegetables, but those like are the worst vegetables. Like I do not like kale. Like it's gross. I'm not a fan. I'll eat some romaine lettuce. I'll eat spinach. But kale is like not for me. No. You can also get vitamin A from yellow, orange fruit and vegetables. So let's show you my yellow, orange section of my colors. We got your yellows and we got your oranges right here. So your vegetables that are that color, like a bell pepper or squash, which I also don't like, pumpkin, you can get vitamin A. Oh, wow. Amazing. Vitamin A is for your bones, your teeth, your vision. There's my eyeball. Acne and psoriasis. And it's especially needed for pregnant women or nursing women or babies, little baby infants. If you have a deficiency in vitamin A, you can have hyperkeratosis of the skin. You can have night blindness. You can have delayed infant growth, which is why infants need it. And you can also just have general weakness. This can also lead to an increase in mucous membrane infections. So vitamin A is a good thing to take. Vitamin D, you get it from the sunshine, which I don't think, wait. Sunshine! The theme of this like playroom that my mom did for my nieces is like, you are my sunshine. And so there's like little suns and like birds and clouds and kites everywhere. So I don't know. She loves Hobby Lobby. Okay, vitamin D. Remember, sunshine vitamin. You can also get it from fish oil, salmon, sardines, fortified milk. It's got to have like vitamin D added into it. Bread, fortified cereals, animal liver, which is just something you don't want to eat. But you do want to eat eggs and butter, so you can eat eggs and butter and get vitamin D. You need vitamin D for your bones and for the utilization of calcium and phosphorus in your body. So that's why vitamin D fortified milk is a thing, because vitamin D inside milk, which has a lot of calcium in it, is a good thing. So drink your milk with vitamin D, babe. Vitamin D prevents osteoporosis, and it can correct rickets, tetany, and osteomalacia. I have no clue if I'm saying that last word right, but vitamin D is just really important. So take it. It's a form, calcitrol, which is the drug name that's right here, is a supplement of vitamin D. It is a form of vitamin D3. I have no clue with the D3. I guess it's like, vitamin B, vitamin B3, vitamin B6 or whatever. There's vitamin D3 and calcitrol is a form of it. This can treat hypocalcemia in dialysis patients and preemies. It can treat hypoparathyroidism, rickets, and hypophosphatemia. So I'm just going to zoom in and show you those again. So vitamin D3, which is in calcitrol, can treat hypocalcemia, which is low calcium, hypoparathyroidism, rickets, and hypophosphatemia. So low levels of calcium, parathyroid, like hypoparathyroidism, and hypophosphatemia. The next vitamin is vitamin E. You get them from fruits, grains, fortified cereals, nuts, vegetable oil, wheat germ, which just sounds gross, eggs, chickens, meat, and fish. And you need vitamin E for antioxidant purposes, and it is deficient in creamies. So I'm pretty sure this is the one. Oh no, vitamin K is what I'm thinking about. But vitamin E is just important. You need it as an antioxidant. Don't really know what it does in your body, but it does something good. Vitamin K, you get it from leafy green vegetables like broccoli, which I'm cool with, cabbage, which I'm cool with, spinach, which I'm cool with, kale, which I am not cool with. It's disgusting. I do not like kale, but you can get vitamin K from kale. Gross. You can also get vitamin K from cheese or soybean oil. You need vitamin K for blood coagulation. It is an antidote for warfarin. Remember that. Vitamin K is an antidote for warfarin. It is also given prophylactically to newborns. I don't know if this is like eye crap that they put on their face or like they give it a shot, but they give it to newborns because babies are not born with those blood coagulation factors. They have to develop them. So they give them this. They give them vitamin K. It's like, hey, welcome to Earth. We're glad you're here. Here's your name and here's some vitamin K into your body. There are 2 drugs that are like a synthetic form of vitamin K. Again, I'm not going to say them correctly, but I'm going to try because trying is a good thing. It's phytonadione. It's like a tongue twister. Phytonadione. Who knows? And aquamethadone. Ooh, that one's fun. Aquamethadone. I'm probably butchering this, but again, they should make these drug names a little bit easier. Like Kansas is a pretty easy drug, like a pretty easy state name. Can a drug be named Kansas? That's easy. Whatever. Who knows? I don't. Not me. Water-soluble vitamins are our next category. Remember, we just did fat-soluble, A, D, E, and K. Fat-soluble means that you do not have to have a daily intake of these vitamins because they are stored in your liver and in the fatty tissues in your body. Water soluble, you got to have every single day because they are not stored in your body. They are easily excreted in urine, which kind of makes sense. They are water soluble. So daily intake is required. I think I already said that, but we said it again. So we have B1, B3, B6, B9, B12, ooh, and C. Not another B, a C. So B1, the drug name is thiamine. B1, you get it from enriched whole grain breads or cereals. You can also get it from liver, beans, or yeast. Again, I don't know who wants to voluntarily eat liver, but you can. And you can get vitamin B1, which is also called thiamine, from it. I'm not going to be eating liver. I'll eat the bread, though. Vitamin B1 is needed for carb metabolism. It's also needed for the integrity of the peripheral nervous system, the cardiovascular system, and the GI tract. So those are 3 pretty important systems in your body. So it gives you a reason to eat bread every day. I'm getting my vitamin B1, y'all. If you have a deficiency in vitamin B1, you can have something called the berry, which are brain lesions. It can also lead to polyneuropathy of the peripheral nerves. And you can also get Wernicke's encephalopathy, which is an amazing word that I just correctly pronounced. Wow. So B1, which is thiamine, the berry is one of the deficiency signs, and Wernicke's encephalopathy. The causes of deficiency of B1 can be because of a poor diet, an extended fever, hyperthyroidism, liver disease, alcoholism, malabsorption, obviously, and then pregnancy or breastfeeding. The next vitamin is vitamin B3. You get it from beans or turkey, tuna, liver, again with the liver, yeast, enriched whole grain breads or cereals, and wheat germ. Yet another reason to eat enriched bread. Yay! You need vitamin B3, which is niacin. That's like the brand name of it, I guess, if you have to go to the store. For tissue respiration. You also need it for the metabolism of lipids, proteins, and purines. It prevents pellagra, which I'm just going to point to it and make sure you know how to spell it because I don't know if that's how you say it or not. I don't know. It's an anti-hyperlipidemic drug. So that's why it prevents pellagra, whatever. And a deficiency in vitamin B3 is pellagra, which is psychotic symptoms, crusting, erythema, inflammation of the mucous membranes, including the oral, vaginal, and urethral membranes, and bloody diarrhea, which is just a lot of things that you probably don't want. So that gives you a good reason to eat enriched breads. I'm just saying. Another reason to eat bread. Vitamin B6. Oh, it's found in whole grains. So you could get that from bread. You could get whole grains from bread. Another reason. You can also get vitamin B6 from wheat germ, yeast, which is found in bread, fish, organ meats. A statement: I never wanted to make organ meats. No, thank you. I do not want liver. I also do not want kale. You can also get vitamin B6 from poultry, meats, eggs, peanuts, vegetables, which you can get everything from a vegetable, and bananas. Vitamin B6 is needed for protein, lipid, and carbohydrate utilization. It can also be used for morning sickness or seizures. It's needed for the integrity of the peripheral nerves, your skin, your mucous membranes, and your hematopoietic system, your blood making system, pretty much. A deficiency in vitamin B6 can be because of an inadequate intake, poor absorption, uremia, alcoholism, cirrhosis, hyperthyroidism, heart failure, or it could be drug induced. So if you take isoniazid or hydrolysine, that can lead to vitamin B6 deficiency. Peroxidine is the vitamin B6 drug name right there. Vitamin B9 is folic acid, and we talked about it previously in the anemia section. Vitamin B9, folic acid, you get it from dried beans, peas, oranges, and green vegetables. Again with the kale. Vitamin B9, aka folic acid, is especially needed for pregnant women to prevent neural tube defects in the baby. It's also needed for erythropoiesis, which is the formation of the blood cells, and DNA and RNA synthesis. Another thing we've talked about is vitamin B12, which is from the intrinsic factor in your stomach. You get it from, so in our notes, it did not ever give us like a food that you get vitamin B12 from. We just learned that it was a shot that like people who lack intrinsic factor have to take a shot every day of vitamin B12. But I looked it up in our book, and the book said that the food origins, or the where you get vitamin B12 in food from, is food from animal origins. Again, with the organ meats, liver. I don't want to eat that. You need vitamin B12 for fat or carbohydrate metabolism. You need it for protein synthesis. You need it for cell growth and cell replication. Things you need it for. And if you have a deficiency in vitamin B12, it can lead to pernicious anemia. So again, we talked about this earlier. Cyanocobalamin is the drug for vitamin B12 that you would be taking. Vitamin C, pretty easy. You get it from citrus, obviously. You can also get it from tomatoes, potatoes, broccoli, spinach, Brussels sprouts, cabbage, green peppers, and liver. You had me at every single thing except liver, because I don't want to eat that. You need vitamin C for iron absorption, collagen synthesis, tissue repair, infection resistance, connective tissue maintenance, folic acid metabolism, erythropoiesis, which is the formation of your blood cells, and you also need it for the maintenance of bone, teeth, or your capillaries. If you have a deficiency in vitamin C, this is called scurvy. So like back in the day when pirates were sailing the high seas and they just had like beer and like fermented crap on the boat with them, they did not have fresh fruits and vegetables. They did not have fresh oranges to eat. They would get scurvy, which is the deficiency of vitamin C. Scurvy is weakness, or can show up with signs and symptoms of weakness, edema, bleeding gums, tooth loss, anemia, bone lesions, and delayed healing. So if you think of a pirate, like, yeah, they're going to be missing some teeth. They could have bone lesions. They could have delayed healing. Like, all things, bleeding gums. You could totally see that with a pirate. Like, I haven't seen a pirate. The name or brand name or whatever you want to call this of vitamin C is ascorbic acid. So just a thing to remember. These are more vitamins: calcium, magnesium, and zinc. Not considered fat soluble, not considered water soluble. They're just important things you need to know. You probably know about calcium already, that you need it for your bones and you need it for your teeth. Growing children and pregnant women and breastfeeding women all need calcium. You need calcium for blood coagulation as well as for your nervous system, your muscles, and your skeletal system. I wonder where I can get some calcium from. I'm thinking you get it from dairy products. Thinking you can get it from a cow. Yesterday we had milk and cookies when Grace came over, and I was like, Grace, do you know where milk comes from? And I was so nervous that she was gonna say like mommy's boobs, because like her little sister like is breastfed, but she just sit there, and then like one of us like went, Murr. And we were like, a cow, you get milk from a cow. So you can get milk from a cow. So you can get calcium from dairy products, fortified cereals, fortified orange juice, and also green vegetables. Again, with the kale. If you have a deficiency in calcium, you're going to see hypocalcemia. Obviously, if you have a deficiency in calcium, you're going to have hypocalcemia. Duh. Hopefully that's a question on our test. You can also see infantile rickets. You can see adult osteomalacia, osteoporosis, which is like holy bones, hyperparathyroidism, and renal dysfunction. With magnesium, magnesium is needed for energy metabolism, nerve physiology, muscle contraction. It stops premature labor, and it can cause short-term constipation. So you get magnesium from your green leafy vegetables, meats, seafoods, milk, cheese, yogurt, bran cereals, which is just a cereal I don't really want to eat. I'd rather eat that than eat liver. So I'd eat bran cereals before I'd eat liver. And you can also get magnesium from nuts. If you have a deficiency in magnesium, I bet you're not going to even know this, you can have hypomagnesia. Magnesia? Magnesia. Hypomagnesia. Magnesema. Low magnesium levels in your blood, pretty much. You can also when you have magnesium deficiencies, you can have malabsorption. It can be because of alcoholism, long-term IV feedings, diuretics, or metabolic disorders like hyperthyroidism or diabetic ketoacidosis. Zinc! Zinc is needed for tissue growth and repair. It's also needed for wound repair. Zinc, wound repair. Z is at the end of the alphabet. W for wound repair is at the end of the alphabet. So let's just say they go together. I don't know. You can get zinc from red meat, liver, again with the liver, oysters, milk products, eggs, beans, nuts, whole grains, fortified cereals, and seafood. Yeah, I'd eat an oyster before I eat liver. Especially if it's like a broiled oyster. Oh yeah, I'd eat that first. So those are your vitamins. Remember, you have fat soluble over here, you have water soluble over here, and then you have calcium, magnesium, and zinc in the middle. And yeah, we're going to end this video and then go on to cancer drugs. Woo! Yeah, that's going to be so fun.